Discover the stimulus. The elephant in the room this holiday season. Access barriers.
Part 3. A discussion about North Carolina's strategy to address access barriers to up-to-date immunization records and communicable disease risk data. So let's get back into this deep dive.
Right. Let's
Now
go.
that we've taken a brief journey through some of the previous and ongoing challenges that exist using the current systems, approaches, patterns, and practices, etc., from our perspective, let's zoom out a bit and take a deep breath to provide another perspective, one that helps to encourage everyone to appreciate that we are all in this together and have work to do.
Exactly. And you're right. All of us have to collaborate to make things better long term and in the meantime. The point of this series is to help all of us to develop distinct task lists that can help all of us get the job done together, because this is the level of engagement that is necessary.
So with that in mind, what are some of the policies or initiatives that North Carolina is exploring or in the process of implementing in order to improve immunization record completeness and accessibility, and to ultimately directly address some of the broad implications related to the management of communicable disease prevention goals, etc.?
That's a great question and an important point that everyone must also consider and emphasize objectively. North Carolina is actively pursuing several policies and initiatives to improve the completeness of immunization data and enhance patient accessibility to these records, primarily through the modernization of the North Carolina Immunization Registry and enhanced data exchange programs.
That sounds promising.
Right. The strategy essentially focuses on, quote, technology and data modernization.
Well, alrighty then. You have me at hello. Please continue.
Exactly. So the North Carolina Department of Health and Human Services Immunization Branch has identified technology and data modernization as a core pillar of its 2023 through 2030 strategic plan. New Immunization Information System. A primary initiative is the development and implementation of a new modernized IIS designed to better exchange, integrate, share, and retrieve electronic health information. This will leverage automation to reduce reliance on manual processes that contribute to errors and delays.
Again, this sounds amazing. Please continue.
Exactly. Then there's the planned patient portal. A significant upcoming feature of the new IIS will be a secure online patient portal. This functionality will provide patients and authorized caregivers for children direct, secure, online access to their own vaccination records, addressing a major current accessibility gap.
And that is the big missing piece of the puzzle that we've been discussing, correct? The part where patients, providers, and caregivers have access to this information and as a result can work collaboratively to help manage this dimension of care and prevention.
That's exactly right. And then there's what's called NC Health Connects integration. NC Health Connects integration. North Carolina is actively promoting and onboarding healthcare providers to submit immunization data to the NCIR via the state's Health Information Exchange, NC Health Connects. This pass-through system streamlines reporting, especially for pharmacies, which administer a large percentage of adult vaccines, helping ensure records are complete in the central registry.
So in essence, we have this technology and data modernization process that's already underway to activate a new system that works better than the current one. And at the same time, there are efforts underway to streamline the process in the meantime.
Yep, that's it in a nutshell. And they don't stop there.
Oh, really?
Nope, there's more. For example, there's this initiative they're calling the Provider-Focused Quality Improvement Programs.
Okay, now we're really taking a deep dive.
Yes, the efforts are going even deeper because, according to their website, the state employs the CDC's Immunization Quality Improvement Program, IQIP, to work with providers enrolled in the North Carolina Immunization Program, NCIP. Strategies include mandatory reporting and inclusion. North Carolina law mandates that all immunization providers report administered immunizations to the NCIR. and all adult and child records are automatically included in the system with no opt-out provision.
Now we're having a conversation.
Yep, you're exactly right. And then there's what they call leveraging NCIR functionality. This is about encouraging providers to utilize NCIR features like benchmark reports and recall and reminder reports to identify and proactively reach out to patients who are past due for immunizations.
That certainly will help to increase participation.
It should, so long as people are cooperative, are following up, and then as an entire community, we're all working to ensure that other access barriers like limited transportation, limited time off from work, limited access to resources, etc., are consistently addressed via solutions-driven approach. These steps should make a difference.
Yes, prayerfully.
Amen. Yes, you're exactly right. Lord willing, and if the creek don't rise.
Amen.
And then there's what they call workflow integration. And that's about working with clinics to improve workflow practices, such as implementing standing orders, allowing staff to vaccinate without a physician order, and ensuring consistent use of electronic documentation guidance to scan paper records into EHRs. And then there's promoting interoperability.
Yes, automation.
Exactly. Exactly. So automated reporting to the NCIR helps providers meet federal promoting interoperability requirements, aligning state public health goals with federal health IT incentives. So let's think of it like this. These initiatives aim to automate data flow, reduce manual error, and eventually provide patients with direct digital access to their complete immunization history.
And all that sounds great, and I can't wait. And yet, as you shared at the beginning of this chat, this strategy is part of the state's Technology and Data Modernization 2030 strategic plan.
Right, which means it's going to take some time.
Wow. Okay.
Yep, I hear you.
What do we do in the meantime?
Well, again, you did it. That's exactly the question. And the answer, what do we, meaning all of us, that means providers, patients, caregivers, hospitals, clinics, pharmacies, the community, what do we need to do in the meantime?
Exactly.
A big step is for all of us to be able to immediately distinguish the difference between, one, a patient copy of you or your child's immunization record from the North Carolina Immunization Registry. It will stick out because it will have the official state seal watermarked in the background. Two, a vaccination administration record, also known as a VAR. And three, an immunization summary or some other similar document that may be printed from MyChart or Epic.
So I get the first one, that the primary document, the gold standard in a manner of speaking,
Yep.
right? But what's the difference between the vaccination administration record and this immunization summary?
In short, there's a mile of difference in terms of getting us where we need to be. Meaning, in the absence of a patient copy of you or your child immunization record from the North Carolina Immunization Registry, the only other choice is the vaccination administration record.
Okay, why is that?
Great question. And the answer is really very simple but requires a lot of words, so bear with me. In short, a vaccination administration record, also known as a VAR, includes specific legally required details like the vaccine manufacturer and lot number, while a general, let's say, immunization summary often omits these, providing only high-level information like the vaccine name and administration date. Other key distinguishing elements on an actual vaccination administration record, again, also known as a VAR, are the administrator's name and title, the injection site and route, and the specific vaccine information statement, also known as a VIS, or addition date, which are crucial for legal and public health tracking. However, this level of specific detail and information is not typically included in, let's just say, a very, very, very basic immunization summary report of sorts, or similar documentation printed from, say, MyChart or Epic or other systems that may be used by some of the big hospital systems and clinics. So the vaccination administration record, or VAR, and this immunization summary are two distinctly different documents. And from my experience, providers, patients, and caregivers can go online and type NCDHHS and vaccination administration record in the search bar, and everyone should be able to easily locate these documents and other relevant documents on the state's official website.
Okay.
And in addition to that, I've learned that in the event that an immunization is not entered into the North Carolina Immunization Registry, we can take our vaccination administration record to our local health department and give it to them, and they will be able to help us with that and give us an updated official patient copy of either our own or our child's immunization record from the North Carolina Immunization Registry.
Well, okay, so that's the workaround in the meantime.
Yes, as we understand it from conversations with staff at the North Carolina Department of Health and Human Services Immunization Branch, our local health department, and local pharmacies as we have navigated these barriers ourselves this year. Still, and as we always stipulate at the stimulus, for the most up-to-date information on this and all other health matters, your first point of contact should be the North Carolina Department of Health and Human Services, your local health department, and your primary care provider so they can provide you with specific guidance that's directly relevant to you and your family's unique healthcare needs. We're just helping to share health education, resources, and tools on the grassroots level in order to encourage all stakeholders to open up the lines of communication on these and other important community health needs.
That's true, so true, and we certainly have done that. And we sincerely thank all of you who have been reaching out to us and to let us know that what we're doing is really helping all of us to build the healthier community that we want to live in together. So with that, take care, continue to enjoy the holidays, and as always, let's remember to stay alert, be prepared, and survive.